Hi, everyone, and welcome. I'm Heather Woolridge, WITF's Director of Community Engagement. Thank you so much for joining us for this special screening tonight. On behalf of WITF, I'd like to thank all frontliners for your service to our community and for helping us stay safe. We appreciate and support you and hope that you are all staying safe. Tonight's post-screening discussion features a panel of experts to discuss the COVID-19 pandemic. How has life changed and where are we headed in the coming weeks? Please welcome Joseph Darius Jafari, PA Post reporter and Frontliners producer, Scott Carnes, owner of Carnes Food, Kier McGuire, Transforming Health producer reporter, and Dr. Ramnaran Boodoo, assistant professor, child and adolescent psychiatry at Penn State Health. Also joining us to help moderate this Q&A session is PA Post Executive Editor Russ Blocker. Thank you all for joining us this evening. We'd like to encourage the audience to also participate in the conversation. So if you have a question or comment, please type it in the chat box. And at this point, we'll go ahead and turn things over to Russ Blocker.
Thank you, Heather. Thank you very much for that introduction. And thank you everyone for being here tonight. We just watched what was essentially 4 short videos on very different topics. We had one about the people who are doing some of the most important work out there, which is stocking our grocery stores, which, as we know, are often scenes of a lot of desperate people looking for supplies, and sometimes those that desperation plays out in tense ways. We also have a story about emergency responders and how they're dealing with the coronavirus. We had a story about a high school senior who is graduating without being able to see her friends and go through all the ceremonies that come with being a senior who's heading off to college. And then we had a very powerful piece about a man in recovery and what the coronavirus is doing to people who are engaged in the 12 steps, who are going to groups, and how does that affect their ability to get the support that they need, that human contact. So I'm going to start with a question for Joseph and Scott Carnes about their video, which was about some workers at the Carnes quality food store in outside of Hershey. Joseph, this video was shot in one night early in the coronavirus, and I'm just wondering, have you been in touch with any of the people who were featured in this piece, and how are they doing?
Sure. So thank you for the introduction. So so we filmed this on March 25th. So that is, over a month and almost 2 months ago at this point. And as we all know, lots has changed since then. We actually have followed up with Bob recently. We did a piece on the radio about him, and he obviously has changed his mind. He saw the documentary and he kind of had a moment of, oh, well, maybe I need to actually care for other people. It's not just about my risk level, it's other people. He did have a big change of heart. We actually spoke to, I mentioned in the chat window that we've also spoken with other grocery store workers, not necessarily at Carnes, at other grocery store chains who were shocked by what they saw, but also, I guess, relieved because they are seeing the same things among their coworkers, people not taking it seriously, not wearing masks, and then kind of just feeling kind of blasé about the entire thing. And so the anxiety kind of has continued on since then for grocery store workers, as far as what, the few that I've spoken with. But also, there are examples of people doing better. And I think Scott could even point out that a lot has been done, to, appease, workers, make sure that they're safe and make sure that customers are, feeling safe as well. But yeah, I mean, it's constantly changing and people are constantly changing their minds on this.
Yeah. Mr. Carnes, could you talk a little bit about your first takeaways when you saw this documentary 6 weeks ago, and how things are changing in your stores and with your workers?
It was very eye-opening. Joseph did a great job with the whole documentary. but it really got us thinking about how to accelerate safety issues for not only our customers and our staff, because it got us, we were able to get those thermometers in ahead of the mandates. I drove multiple states to get masks. It was just one of those things that made us start thinking about what additional issues we could do. So we got a lot of programs started and set up well before the government mandates came in. And I wish we could have started them sooner, but this was changing by the day and sometimes by the hour.
Well, we've heard from grocers around the country that some employees have contracted the coronavirus, some have gotten very ill. And I'm just wondering, is your workforce safe? Have you had any cases? Is everyone okay?
Fortunately, we have had no cases at any of our locations, and that's been wonderful. I continue to pray and hope that continues going on. I think that now by having the masks, by having the sanitations, by having a lot of the procedures that the governor has put into place, it is hopefully curbing some of this transmissions that could occur.
Yeah. Well, before we go over and ask a few questions of Kira and Dr. Boodoo, I wanted to just ask, we're seeing a lot of frustration and impatience out there. People are tired of living this life under lockdown, and there's starting to be some, if there's a video going around from a restaurant in York over the weekend with people getting very upset about someone who, I'm not sure what the circumstances was, but I think she wasn't wearing her mask inside a restaurant. And so I'm just wondering how your workers are dealing with customers. Are you having any problems? Is there any sort of extra training or work that you've had to do for them?
Well, we've certainly had to do extra training and work, but we really have put the confrontation issue to the management staff. I really do not want to put any general staff in harm's way. Unfortunately, we've seen some tragic stories across the country that I just do not want to have somebody engaging with a customer that you don't know what the situation is. They aren't trained for this type of engagement, and it's not the proper place for them to be.
Right. Well, I want to get to our other guests, Kira and Dr. Boodoo. Dr. Boodoo, you saw these short videos today probably for the first time, and I'm just wondering, when you looked at the three very different types of people that Kira documented for us, what were you thinking about as a professional psychiatrist?
Sure. I was thinking that coronavirus and the pandemic brought about is really at the juxtaposition of medicine and medical science, along with economics and social justice. We have someone in Olivia who is really getting prepared to launch into adulthood, and the visible anguish that could be seen was really to be expected in a situation like this. Of course, you can always have the flip side, where let's say there's a young person who is being bullied or does not like going to school or learns better online. Then that aspect has actually been enhanced by the pandemic. But I suspect that for most young people, Olivia's experience is typical. And so we have Olivia on the one hand. The next person was the gentleman struggling with addiction. And he is further along in life. He has a daughter. And there are special considerations relating to COVID-19 and the treatment of addictive disorders. On the other hand, you have, as was shown, the healthcare providers. So essentially, the COVID-19 pandemic affects each person differently based on their life circumstances. And not just that, based on their experiences, their goals, hopes, and dreams. And So I think we have to understand that the pandemic affects all of us in common ways, meaning that we all have to ensure that we maintain social distancing, follow recommended guidelines, stay-at-home orders, and so on. But the effects go beyond that to affecting us as individuals based on our situation in life.
Yeah. Well, I wanted to go to Kira really quickly and say, Kira, first of all, these were three amazing people that you produced these diaries from. But as long as we're talking about Olivia first, have you spoken with her recently, and how's she doing?
Well, I have not spoken with Olivia within maybe the past week or so, but I am familiar with through her mom that she is still struggling with the year as it has turned out. But she, as you noticed, is a very, very bright girl, and she has a bright future ahead of her for sure. So I think that she's really wrapped her head around the fact that, you know, she's making the best of the situation, the best that she can.
One thing that was really striking to me is that her mood changes pretty radically as the installments keep getting updated. She's a very young and chipper and sort of positive outlook at first, and then it just starts to go down from there. Yeah. How was that to produce?
Right. She was very brave and open in taping her video diaries. And I did ask if it would be possible, when we heard that schools were closing, if it would be possible for her to do a video diary at that point, so that we could really feel how that would sink in for someone in a real way. And as I understood, her mom said she was pretty upset at the time, but she would try to come back to it. And I think that that's what she did. She waited a little bit, let it sink in, and then did her video diary. But yeah, it is sorting through the video diaries as they come in this new way that we have to produce things. It's often that I'm sitting there just listening to people and their personal thoughts, and it really wraps you up, because you feel like you can experience this along with so many different people and so many different challenges that everyone's facing. It's this common thread that we all have, but it's impacting us in different ways.
Yes. Well, Dr. Boodoo, one thing I was curious about watching the very first segment that Kira produced with the emergency responders is just that was early on in this era of the coronavirus when he was providing his diary to her. And I'm just wondering, have you seen from your colleagues, from people in the medical community, a change in their psychological well-being and their mental health, and how are professionals like yourself trying to address their issues?
Undoubtedly, and that is a great question. Where I work at the Pennsylvania Psychiatric Institute, there have been discussions about how our facility and our institution is going to handle COVID-19. And I'm sure that these discussions have happened many times over in many other institutions, including the Carnes supermarkets. Because of the rather invisible nature of the pandemic, nobody can see these virus particles. There seems to have been a sense of concern, but in a different way than you would expect if, let's say, you could see the threat coming, let's say, for example, with an active shooter or something like that. The concern has centered around how do we as healthcare providers adequately protect ourselves and our patients so that we can continue providing the care that everyone needs. And this has been a difficult question to answer, especially in light of personal protective equipment, PPE shortages. Nevertheless, I'd like to think that most of us have persevered, and even if there was no PPE available, we would still be there taking care of our patients. And I think that that spirit of camaraderie and of duty, spirit of duty, really helps us to keep going.
That's great. And Mr. Carnes, your store employees, particularly the ones that are dealing directly with customers, they must have some, it must be hard for them as well to know that they're going into a place where they could potentially be exposed because of the traffic coming through the stores. And I'm just wondering if you wanted to speak to this a little bit.
We do hear that on a daily basis from our staff. They are very appreciative of the issues that they've done from a safeguard, and they've been great about the hand sanitizing. What the CDC has said. By getting up the plexiglass, we were fortunately able to get in shields. Although I haven't seen a lot of our staff using the shields, the plastic shields. We did buy in a few thousand of those just so that we have them on hand, and we have a lot of products. But yeah, they worry about it every day. And I think in general, what I hear from them is they feel comfortable in their own selves and in the staff that they're working with. It's the staff not the staff, but it's the customers that are coming in. Have they washed their hands before they come? Are they following procedures? Do they take their temperature on a daily basis? Items that could really protect my staff at the store level.
Right. Well, I wanted to go back to Kira, and I know, Kira, you've done a lot of reporting over the past few years on addiction and substance abuse, and Dan's story that you brought to us was really powerful. I was impressed by him, but he and his roommate are struggling with the lack of social interaction. And I wondered if you could talk a little bit about, just based on your experience covering these issues and the diaries that they provided to us, how we as other people in the community can support people going through recovery like this.
Sure. Yes, Dan is a very powerful speaker. I've interviewed him before, and he has the thing that I've been introduced to the most in talking with Dan is how connected the community, the recovery community, is very strong. It's growing. They are very connected in recovery. And so when the coronavirus struck, yes, it has separated folks in recovery, and they've had to be very resourceful in ways to find connection with each other. But I do think that they are, in my interviews with him, that they are succeeding in that. At least Dan and his friends in recovery are succeeding. I will say that he just has this way about him that is very inspirational, and he says that it's important to reach out to others in recovery. So anyone else in the community that's interested in something that they can do, if they have a friend in recovery, what I've been told is just go ahead and reach out as often as possible. Just even a simple phone call, let someone know that you're thinking about them in this time of separation, and it can go a long way.
Great. Well, I wanted to bring Joseph back into the conversation a little bit, and just Joseph is a very keen reporter who covers a lot of different social justice issues for PA Post. And I'm just wondering, Joseph, when you look at the videos that Kira produced and yours, what are your overall thoughts here, and what kind of questions do you have for the rest of the panel?
My gosh, I mean, especially when I look at the recovery community, and especially when I think about EMT workers, a lot of my thoughts immediately go to how, as a society, are we making sure that we're helping these people? Because I think, as we've seen throughout this entire pandemic, is that Americans have a really hard time about thinking about others as much as we think about ourselves. We have this rugged individualism that's built into us that just isn't with a lot of other countries. And so when I think about, the EMT worker, what is being done to help them, we often don't really think about them. We don't put them on the top of the list. I think I mentioned in the documentary, when we think about frontline workers, we think about, police, firefighters, and those kinds of people. And at some level, when you walk into that job, you know exactly what you're signing up for, and the job actually protects you. you know, I want to point out like what Scott said earlier is that he wished that he could have done something earlier. He hopes that he did something earlier. I don't think it's anybody's fault that, looking at the hindsight of this all, I don't think it's anybody's fault that nobody did anything, sooner than expected. I mean, if you think about it, OSHA standards for grocery store workers with the CDC didn't come out until April. I mean, what Scott was doing when we first released, when he put up the guards, was before even all that happened. So, my initial question is, what is being done in the community to make sure that they actually care for these workers, these frontline workers, and also, these people that we highlighted here in these documentaries. And I'm not sure there's a really clear answer on, what is being done outside of just, diligence and making sure people are responsible and adult about their actions. We can only hope that people, look out for their neighbors. But when it comes down to it, we really have to rely on the goodness of others to care for us. And that's a big concern that I have. So.
Yeah. Well, Dr. Boodoo, it's almost surreal, this period that we're going through. It's not like anything that I've faced in my 50 years. And I'm just wondering what you think sort of the societal mental health impact of this is going to be, knowing now that we don't know when this will end.
That is again a fantastic question, and I think you really summed it up very well at the end of your question by saying that we don't know when this is going to end. Human beings are inherently social and do not like uncertainty. And if you could pick something that would cause a whole bunch of uncertainty, it'd probably be this, a pandemic. We don't know when it's going to end. There are a lot of people out there who don't know when they'll be able to return to work. There are people out there who don't know how they're going to manage their upcoming rent payments, how they're going to put food on the table. There are people who are stressed out, burned out, and don't know when there's going to be some sort of a reprieve. And the mental health consequences of uncertainty in general can be very unpleasant. I was at a talk years ago when I was in residency in Buffalo, New York, and the speaker said, "Do you know how we induce depression in rats in the lab when we want to, test certain interventions on rats who are depressed?" And the answer was, you subject them to chronic, unpredictable stress. And over a certain period of time, you could expect the rats to start to display signs and symptoms of depression. Well, this coronavirus pandemic really has in many ways subjected us collectively as a society to a period of intense, unpredictable stress. And depending on how much longer this goes on for, will really determine both the intensity and the duration of the mental health effects down the road. There is information, there is data from studies that were done after the SARS epidemic in 2003 that shows that for years, 2, 3, and even more years afterwards, individuals who developed anxiety, depression, continue to experience moderate to severe symptoms. About 30% of individuals continue to experience moderate to severe symptoms after 3 years. So these stressors that we're experiencing, the ramifications can go on for some time.
Yeah, and do you have advice for? I don't want to sound trite here, but do you have advice for someone like Mr. Carnes, who's got several hundred workers that he's taking care of in the middle of all this? How do you take care of people that work for you when you are faced with your own uncertainty about how this is all going to play out?
Sure. In the healthcare profession, we experience this a lot as well. One of the main areas of concern for us is what's called vicarious trauma or secondary trauma or compassion fatigue, where caring too much, being exposed to too much of the sickness and its effects really starts to take a toll on us, even though we're not directly impacted. I could see Mr. Carnes being at risk of that because he has a number of employees that he clearly cares about. And if they were to fall ill, if they were to end up in a confrontation with someone and become injured, it's hard not to take things like that personally, not to wonder what you could have done, not to feel like you need to shoulder some sort of blame for that. And that's compounded by our current state of uncertainty and evolving awareness of this illness. So if I had to give Mr. Carnes some advice, it would be that I think that as long as you know that you're doing as much as you can for your employees, then you have every right to rest easily at night. There's nothing that should prevent you from putting that burden down when you go to bed at night.
Mr. Carnes, what do you think about that?
Well, Doctor, I do think about these things every night, all the time, and I'm great. I got a wonderful, supportive family, and I worry about our associates the same way. And we've given a lot of associates who said they can't handle the stress of this are taking extended leave, knowing that they can come back to their work at a later point. I talked to our HR department in the last week, and they said, they were surprised how many people have asked for extended leave and are taking that. And that's fine, because these are uncertain times, and I don't want anyone to feel like they're endangering themselves. And some people have immune issues. So that was another issue that we don't want to have them exposed. And I don't want to carry that burden with me. So we think about it all the time, just like I think every family, employer, everybody thinks about this. I feel like, I told my wife this morning, I said, I feel like I'm in Groundhog Day. Every day I wake up and I think about the COVID and what are we going to do and how can we take care of things? And it just goes on and on.
Well, thank you for that. We have a question from the audience. I think best for Dr. Boodoo. Do you have any key phrases that are good for letting friends struggling with depression know that you're there for them? And what's the best way to check in? And I suppose that also would apply for someone struggling with addiction.
Sure. Well, let me split the two. I'm gonna first talk about how to support someone with no mental health, no pre-existing mental health issues, or perhaps mild mental health issues, then focus on somebody with addiction issues. So if there's, let's say, a family member who's in a nursing home, and you're not wanting to visit, or you cannot visit because of the risk of transmitting the infection, actions speak louder than words. And so if you really want to communicate to somebody that you're there for them, one of the best things I think you can do is reach out frequently, speak with that person frequently. People like to be reassured, and reaching out consistently is one of the best ways of displaying that you genuinely do care. Everybody's busy. And for me to take time out of my schedule 3 times a week, let's say, to reach out to somebody on a consistent basis really shows that. What else I would say is, besides just saying, I'm here for you, if you need anything, let me know, is to, if you're involved in that person's life, you would know other people in that person's life. And it would be helpful to touch base with them to find out how the person is doing. So that way, when you call and you speak with the person, let's say the person at the nursing home, relative at the nursing home, you can say, well, hey, listen, I I talked to your brother Joey the other day, and he tells me that you've been crying at night. Tell me what's going on there. You know, what's that about? Can I do anything for you? Oftentimes, folks, especially as Joseph alluded to, the folks with the spirit of rugged individualism do not like to depend on other people. But this is one period in time when we really do have to depend on other people in our life. And so simple things, even if there's somebody who's in the hospital, in a nursing home, simple things like adequate clothing, hygiene products, and so on. If you could just say, you know, hey, how are you doing? Do you need any of this, You know, I don't mind bringing it, dropping it off for you at the facility, and so on. So likewise, these interventions would be helpful for individuals with, let's say, mild degrees of anxiety or depression. One of the, and this is coming back to an earlier question, one of the things that we can expect to see increase is loneliness, especially in older individuals who are perhaps already socially isolated to begin with. And this is a good segue into folks with addiction issues. Now, from a psychiatric perspective, addiction can be conceptualized as a mental vulnerability. And individuals with addiction issues can have other comorbid psychiatric conditions as well. And stress is a leading cause of relapsing on drugs. So if I was wanting to be supportive of someone with an addiction issue, I would do everything that was just mentioned, but also if I'm aware of the addiction issue, say, hey, how are you doing with the addiction stuff? Have you been using? Do you need me to come check on you at all? Do you have a sponsor? Can I speak to your sponsor on your behalf? Have you been going to the opioid treatment program? Do you need transportation or anything like that? If, you know, of course, illness permitting. The other thing to keep in mind about addiction is that addiction is a stigmatizing issue. So you would never want to say something like, you know, hey, you had addiction before, how you doing with this COVID-19 now? You know, you never want to stigmatize the person even more. So the use of language would be very important.
Well, thank you. The conversation's been going on for about half an hour now, and I did just want to go back to the reporters, Kira and Joseph, very quickly, and just sort of ask you, you know, what you've learned about the beats that you cover in the 2 months now that we've been wrapped up in this coronavirus experience, and what are you going to do next, and what projects are you working on now, and what can we look forward to? So Kira, I want to start with you.
Sure. Yes, I am continuing to produce these coronavirus diary pieces, and they will actually be kind of packaged into a show that's going to air next week. So that will feature a lot of the stories that you saw here, but then a bunch more as well. And I think the thing that I've learned from working on this is just that as we work our way through this, it's something that, like I said before, we all have in common. And so even though we're all having different struggles, it's something that we can all relate to. And in that way, although we're apart, it seems to be pulling us together in some ways.
Great. Joseph, how about you?
Sure. So I think one of the things that, just to kind of start off, like what we've learned in the past couple months, I said it from the very beginning, and I'll say it again now, which is that the coronavirus has only kind of exposed what's already wrong with like America when it comes to, you know, like I cover criminal justice. Like we've been talking about for years, the fact that prisons and jails are vectors for disease, are problems with healthcare.
Looks like Joseph may have dropped out
because
there.
We see.
Here he is. You dropped out a bit there, but pick up where you are.
So basically, you know, when it comes to like my beat specifically, criminal justice, it's interesting because we've been saying for years that these are problems that we see within our system, and now COVID has just broke it all open, and prison is now the hottest beat. You know, I think as we continue our lockdowns and as we continue to look at, you know, like segmented our population.
Well, that may have been, there he is.
Sorry, my internet is terrible right now. Anyways, I'll leave it at this. I think it's interesting the fact that like COVID has only brought, you know, issues forward that we've been talking about for a long time, but now we're looking to talk about solutions to fixing them. As far as like what I'm working on in the future, you can tune into, you know, March 27th, we're doing another one of these for my latest doc, which is about veterans within the criminal justice system. And then also, you know, we're coming out with a lot of different stories about how coronavirus is affecting people within prisons and jails, and kind of what's happening with their families on the outside. It's an entire, you know, this beat will continue to go, and it'll continue to grow with only, you know, as coronavirus continues to, as more as, you know, we continue our lockdowns.
Great. And that's May 27th for the documentary, that next one that we're going to be screening like this, not March 27th. Although I wouldn't blame you for thinking March, because it was the last time we all saw each other in person.
What is time anymore?
What is time? Exactly. Well, I want to thank everyone. This has been a great conversation. Dr. Boodoo, Mr. Carnes, Kira, and Joseph, I've really enjoyed the evening. I'm going to hand it back over to Heather and let her sort of wrap up the conversation, and thank you all.
Thank you, Russ. Thank you so much for hosting a really insightful post-screening discussion, and thank you to all of our panelists for joining us this evening. Just a reminder that to check out and join us next, Wednesday, May 27th at 7 p.m. right here on the OV platform. We're going to do a screening and panel discussion around Joseph and PA Post's new documentary, Time Served. And as Kira mentioned, the Transforming Health hour-long special, the Coronavirus Diaries, airs Thursday, May 21st at 8 p.m. on WITF TV. Our next virtual screening comes up next Wednesday, May 20th at 7 p.m. We'll host a preview screening event featuring the new PBS documentary, Viral Anti-Semitism Informed Mutations. This is a first look before it premieres on WITF TV, and will feature a Q&A with one of the film's producers. You can visit WITF.org/events for more information and to register to attend. Thank you to the audience, everyone, for joining us this evening. We hope everyone stays safe and healthy. Have a great night, and we'll see you next time.
Thank you.